A review found the boy was incorrectly triaged, and 2 hours after arriving at that emergency department, he died. Well, Independent MP for Mackellar, Sophie Scomps, joins us now. Thanks so much for coming into the studio. I want to begin by talking about beautiful little Joe Massa, a 2-year-old boy who died after being denied adequate care at Northern Beaches Hospital. How has he failed in so many ways?
Well, I think absolutely Joe and Joe's family have been utterly failed. It is hugely devastating to hear that news, and I can't imagine the pain and distress of the family looking for care, and the care didn't arrive.
I guess so many parents take their kids into a hospital in good faith that they're going to receive care and they're going to get help. His parents didn't get that and he didn't get that. No,
it's utterly devastating. And I think we need to look at what's happening in the hospital. There's been lots of concerns raised about the way that Northern Beaches Hospital has been run. It's a public-private hospital. It's the only one left in the state that's run that way. And I've been hearing from patients, from staff, nurses, doctors consistently over the last couple of years that the way the staff cuts that have been happening within that hospital are making it really hard for nurses and doctors to deliver the level of care that's required. And even today, there was going to be a nurses' strike today. Nurses don't go on strike unless there is a real problem within a hospital. They just don't do it. And so what they're saying is that the staff cuts have put them in a situation that they're unable to give the care, the level of care that's required. They're burnt out. Many of them are leaving in droves. This is not the type of culture that we want within a hospital. And so we do need to look at what's happening with a private operator running a public hospital.
We know burnout is a huge issue across the board. In Joe's case, his mum asked 3 times for an IV trip, a pretty basic, simple request, and she was denied that. He was denied that. You've worked as an emergency doctor. Why are there cases where parents' concerns are falling on deaf ears?
I do actually think experience is really, really important, and to recognise the signs comes with experience. And what I'm hearing from nursing staff is that because of the conditions within the hospital, many of the experienced staff are feeling like they're not being heard and leaving the system. So, and they're under conditions where they are just stretched to the limit. So I can't comment on the individual case, I just don't know the details. But it certainly is an absolute tragedy, and I think we really need to look at what is happening inside that hospital.
Northern Beaches Hospital is in your patch. Have you heard of any other patients that haven't received adequate care?
Look, I have. I've had many patients come to me, I've had many nurses come to me, I've had whistleblower doctors come to me as well. All are calling out what is happening inside the hospital. And I should say that the doctors and nurses, the staff are highly professional. Everyone is doing everything they can, but they are stretched to the absolute limit. There's a new Facebook page, or I think a number of Facebook pages that have come up with all these testimonies coming out. And so we have to listen. We absolutely have to listen to what's happening here. The level of care is not to the standard required, and I think we need to look at the how that hospital is being run. We should not. It is a failed experiment to have a public hospital run by an organisation that is driven by profit.
Have you heard about any other patients who have died as a result of staffing issues?
Well, there's quite a prominent case with Joshua Gill, who was a patient who was seeking mental health care, was discharged and soon after died.
The hospital is run, as you mentioned before, under a controversial public-private model with HealthScope operating the facility. Nurses today claim that they're dealing with unsafe staffing levels as a result of that operator. You yourself have said that lives are at risk. What needs to happen?
Well, one very simple thing needs to happen. The nurses are calling for minimum standards when it comes to nurse-patient ratios. Every public hospital around the state will be adhering to those minimum staffing levels, the safe staffing levels. That isn't being applied at HealthScope. But I think we need to go one step further now. I think this is a line in the sand, and we really need to look at returning Northern Beaches Hospital back to public hands.
But is that an easy process?
No, I'm sure it's not an easy process, but I think there's an understanding. There was an inquiry done in 2020 following the opening of the Northern Beaches Hospital, which looked into this and found that public-private partnerships for hospitals were not in the best interests of patients or the staff, and that there should be no further. There was 5 that were in the pipeline. All of those were pulled. They were for regional hospitals. All of those were pulled. Northern Beaches Hospital is the only public-private hospital that is in the state currently.
There are obviously a lot of deficiencies within our health system. Sophie Scomps, thank you so much for your insights today.
Thank you.
Home Affairs